Hey everyone, just wanted to share three quick things that I think everyone should know following a hip replacement surgery. This comes from almost 10 years of treating patients after both hip and knee replacement, and I think if people knew this ahead of time, it would save them a little bit of anxiety and a little frustration in those early phases after surgery. Number one, your hip will feel tight. It's going to feel stiff. It's probably going to be the biggest complaint that you have after your surgery. And interestingly enough, it's not going to have any bearing on how much or how little exercise or walking you do. So, what I mean by that is that if you feel stiff in that hip and you get up and walk around, it's going to loosen it up. It's going to make it feel better and more mobile. But the moment you sit back down and just wait even 2 or 3 minutes, if you stand back up again, it's going to feel like that stiffness and tightness comes right back. So, don't let that frustrate you and don't let that make you not follow the program or just trust the process. That over time that will improve, but in the early stages that hip is going to be talking to you constantly, and it's going to make you feel like you need to be moving more and more, when in reality movement is good and you want to do that, but you don't want to be your own worst enemy and over push it. So just trust the process, know that it's going to get better with time, and I think the most important thing in that early phase is just do what we call active rest. So you're going to stay moving, you're going to stay active throughout the day, but you're also going to give yourself adequate rest time so that you're not just constantly on the go, which is going to create more irritation and inflammation in the tissue. The second tip is that a recliner can be very beneficial in the early stages, both for comfort as well as for sleep quality, and sleep position. So most people find that they don't like laying on their back after surgery, but they're not quite confident or comfortable yet going on their side. So no problem. If you have a recliner, the best thing you can do is recline that thing back. It probably doesn't go all the way flat, which is fine, but you can take a pillow and put it sideways under your knees just to let your knees be propped up a little bit more. That usually feels really good on the hips, especially in the first week, maybe 2 weeks, excuse me, outside of surgery, when that hip can feel some of that tightness and stiffness and that swelling is hanging around. So, best thing you can do if you can't get comfortable in bed and you do have a recliner, recline it back, put a pillow sideways under either one knee or both knees. If you don't have a recliner, you can always lay flat in bed and do the same thing. You're just not going to have your back propped up as much as if you would be in that recliner type position. The third tip is that there is no set time for the use of a walker. So a lot of people hear some, varying things in the early process of you should be using a walker for 3 days, 1 week, 1 month. Sometimes even surgeons give preferences on this. Very often, it's not really a surgical issue that we're waiting for to get off that walker. It's more of a fact of when are your pain levels controlled? And most importantly, when do your gait mechanics, meaning your walking mechanics, when do those look perfect? So we want to wait to hold off on something like the cane until you can walk with the cane just as well as you can walk with the walker. Most often, this means the point in time that you can allow your surgery leg to take the same size step as your non-surgery leg. If you can't do that, you are not ready to get rid of that walker, and it does not matter if it's 2 days, two weeks, or 2 months for that matter. So either talk with your surgeon, talk with your physical therapist, whoever you might be seeing, post a video so other people can give comments on what they think is going on or how you're doing in that regard. But just know that there is no set time for a use of walker, regardless of any protocol you may see, or things floating around you might have heard of. So as always, this is not any medical advice. You do need to be looked at by a trained professional, whether it be a physician or a physical therapist for that matter. But these are a few quick tips that I think everyone should know before they head into a hip replacement, or if they seem to be in those early phases after a hip replacement where it can be very beneficial. If you have any questions, drop a comment below and we'd love to chat about it. Thanks. Talk to you soon.